This patient had implants placed several months ago that were allowed to heal in a delayed restoration protocol. The denture was relined with soft reline material to limit forces applied to the implants during integration. This denture will be converted to a fixed bridge using the LOCATOR F-Tx attachment system. As the tissues are healed, final impressions will also be taken to allow for fabrication of a final prosthesis. Healing abutments are removed from the implants using the appropriate driver for the respective implant system. The soft tissue thickness is measured with the use of a periodontal probe to determine the appropriate abutment cuff height at each implant site. If the tissue is uneven around the implant, take the measurement at its highest point. This is the cuff height required. For most implant systems, LOCATOR F-Tx cuff heights range from 1.5 millimeters to 6 millimeters. LOCATOR F-Tx attachment system components, with the exception of the block-out spacers, are provided sterile in an all-in-one custom-molded vial that is sealed in a Tyvek-covered plastic tray. The abutment is suspended in a cap on one end of the vial, and the restorative components are stored in the adjacent vial compartment. The restorative components include a denture attachment housing with pre-assembled black processing ball, as well as low, medium, and high retention balls in blue, tan, and green colors respectively. The package also includes a multilingual instructions for use document, as well as a 2-pack of block-out spacers. The block-out spacers are provided clean but are not sterile. The LOCATOR F-Tx abutments may initially be delivered to the site using the vial cap in which they are suspended. Additional tightening is performed with the dedicated 2.6 millimeter abutment drivers. There is a square drive version which fits into drivers that accept this interface. There is also a latch lock version that fits into some drivers and/or contra-angle handpieces. The abutments are torqued into place, typically to 30 Newton centimeters. For implant systems with a thread diameter less or equal to 1.4 millimeters, it is recommended not to exceed 20 Newton centimeters of torque. The LOCATOR F-Tx system has dedicated impression copings used to create a master model for fabrication of the final prosthesis. The impression coping comes delivered with a black processing ball pre-inserted. It is always recommended to check that the black processing balls are tight. This is done with a 0.05-inch or 1.25 millimeter hex drive. The ball should be finger tight. Do not over-torque. The impression copings are snapped into the LOCATOR F-Tx abutments. The impression copings are able to pivot up to 20 degrees in any direction, thereby allowing the impression copings to be aligned. This ensures that the denture attachment housings will remain within the confines of the final prosthesis. A light-bodied impression material, such as Zest CHAIRSIDE material, is applied to the impression copings, ensuring that material is applied to the undercuts. Medium or heavy-bodied material is loaded into the impression tray. Care is taken during the insertion of the impression tray to avoid knocking the impression copings and altering their position. Once cured, the tray is removed and the impression copings are captured in the impression, available to the dental laboratory for creation of a master model. If the LOCATOR F-Tx abutments will not be immediately restored, peak healing caps are available and can be snapped into the abutments. To proceed with the fabrication of a provisional prosthesis, the denture attachment housings will be inserted into each abutment. Each black processing ball is verified for tightness prior to insertion. The denture attachment housings are snapped into each abutment. The housings can pivot up to 20 degrees in any direction, allowing them to be reasonably aligned when implants are convergent or divergent. This alignment helps ensure that the housings will be picked up within the confines of the patient's existing denture. In this case, the patient's denture already has recesses for the healing abutments that were previously in place. The denture is trial fit to ensure the recesses have sufficient clearance for the denture attachment housings. There should be no contact between the denture attachment housings and the denture. Relieve the denture further if necessary. If this were an immediate case, the position of the denture attachment housings could be marked with a light-bodied PVS material, and recesses could be created using Zest CHAIRSIDE preparation and polish kit. Prior to CHAIRSIDE pickup, it is important that the denture attachment housings are clean and dry. Wipe with gauze and air dry prior to application of the pickup material. Undercuts should also be placed in the denture recesses to ensure mechanical locking of the pickup material. A suitable material, such as Zest CHAIRSIDE attachment processing material, is applied to the denture attachment housings and to the recesses in the denture. A lingual vent hole may optionally be created at each pickup site. This can reduce pressure and create an exit point for excess material. If the bottom sphere of any abutments are visible super-gingivally, the blockout spacers or blockout material can be used to prevent locking the provisional restoration to the abutments. This was not necessary in this case. The denture is seated over the denture attachment housings, taking care during insertion not to alter the position of the housings. Light pressure is applied initially by the clinician, and then the patient is put into light occlusion. The CHAIRSIDE attachment processing material is dual cure, so UV light can be used to accelerate the process. Once the pickup material is cured, the denture is removed. The black processing balls are intentionally designed with a low retention force of approximately 2 pounds. This prevents excessive tensile forces from being translated to the implants, especially important during immediate implant placement cases. Small voids around the denture attachment housings can be filled and light cured. The CHAIRSIDE attachment processing material has an angled microtip for this application. The material also bonds to itself. The black processing balls are removed from the denture attachment housings and replaced by polishing protectors. The denture can now be trimmed and converted into a provisional bridge. Final polishing can also take place. The CHAIRSIDE preparation and polish kit is helpful for this modification. The polishing protectors prevent the seating surface of the denture attachment housings from being damaged during these procedures. The polishing protectors are removed from the denture attachment housings and replaced with black processing balls. The black processing balls can wear after repeated insertions and removal. If retention is deteriorating, replace the black processing balls. The LOCATOR F-Tx attachment system packaging includes an extra black processing ball for this purpose. The provisional bridge is now inserted to check for final fit and occlusion. It is generally recommended to try and engage the posterior units first, and then roll the bridge towards the anterior abutments. This is especially important when the posterior implants are angled. Marking paper can be used to highlight areas of the provisional bridge that may require adjustment. Once final adjustments are complete, the provisional bridge is removed and the black processing balls are replaced with peak retention balls. There are 3 levels of retention, with the blue balls being the lightest, at approximately 5 pounds of retention force, beige at a medium force of 10 pounds, and green providing the highest level of retention at 20 pounds. In this case, the clinician chose the medium beige balls for the provisional phase of treatment. The peak retention balls are inserted and removed with a 0.05-inch or 1.25 millimeter hex driver. Zest offers a unique driver for this dimension that can remove a retention ball in the event it has been stripped or over-tightened in a clockwise manner, as demonstrated in the video. The counterclockwise operation of the Zest driver allows the tool to grab the plastic and unscrew the damaged retention ball. The provisional prosthesis is now reinserted. Once again, the preferred technique is to try and engage the posterior units first, and then the anterior units. The patient is requested to bite cotton balls with reasonable force to ensure the retention balls are fully engaged into the abutments. Radiographs are taken to ensure that the retention balls are properly seated. The denture attachment housing should be in intimate contact with the spherical portion of the abutment without any gaps. Incomplete seating could lead to dislodgement of the prosthesis or the buildup of plaque and calculus in the abutment and denture attachment housings. There are two methods to remove a LOCATOR F-Tx prosthesis. The first method relies on leverage. A removal loop is inserted underneath the prosthesis with the metal end towards the facial. Both ends of the loop are folded so two loops are visible above the occlusal surface of the prosthesis. A removal toolbar is passed between the loops with the white Delrin tip facing lingually. The Delrin tip is placed on the contralateral side of the prosthesis, serving as the pivot point. As the removal toolbar is lifted, it disengages the balls from the abutments. This can be repeated if necessary, although sometimes the prosthesis can be fully disengaged at this point manually. The second removal method involves fluid displacement. Prosthesis boosters are inserted between the underside of the prosthesis and the soft tissue at gap points between abutments. The most lifting force is created when the prosthesis boosters are co-located in one quadrant versus spread out across the entire arch. An inflation device drives sterile saline to the prosthesis boosters, causing them to inflate. Once inflated to sufficient pressure and dimension, the prosthesis is disengaged from the abutments. This may be repeated on the contralateral side of the prosthesis if needed. Local anesthetic may be used at each prosthesis booster site to relieve patient discomfort. It is also important that the design of the prosthesis is properly treatment planned such that sufficient space is available to accommodate the prosthesis boosters. Sometimes a lingual approach for insertion may be easier. The system includes all the core laboratory components for producing a variety of different definitive restorations, from all acrylic to full zirconia. To create the master model, the LOCATOR F-Tx abutment analogs are inserted into the impression coping. A stone model is poured. In this case, a soft tissue model was created, which has been removed for better visibility of the abutment analogs. Note that the abutment analogs have a modest shelf. This prevents the denture attachment housings from pivoting freely during fabrication of the prosthesis. The denture attachment housings with black processing balls are inserted into the abutment analogs. As the denture attachment housings cannot pivot on the analogs, they mimic the orientation of the impression copings at the time of impression. Note that the denture attachment housings can be sprayed and scanned for production of milled prosthesis under digital workflows. The system also has waxing copings that fit over the denture attachment housings and are used for the creation of cast frameworks or copy milling of wax bars or frameworks. If picking up the denture attachment housings intraorally in the final prosthesis, these copings can also be used to create a jig to orient the position of the denture attachment housings in the mouth to match that used by the laboratory during fabrication of the definitive prosthesis. The framework is designed and milled. The provisional prosthesis is removed and new denture attachment housings are snapped into the abutments, ensuring each black processing male was finger-tight prior to insertion. The denture attachment housings are aligned. In this case, the clinician elected to pick up the denture attachment housings in the milled framework using cement. This could alternatively be done chairside at the time of final prosthesis delivery. The framework is inserted back on the master model, and the prosthesis is completed using standard laboratory techniques. The system also includes processing caps used by the dental laboratory when creating all acrylic restorations. These processing caps fit over the denture attachment housings and create a definitive stopping. The final prosthesis is delivered with black processing balls in place. Ensure that all of the black processing balls are finger-tight prior to trial insertion of the definitive prosthesis. The final prosthesis is seated, engaging the most posterior units first as previously described. Occlusional checks are performed on the final prosthesis and adjusted as necessary. The prosthesis is manually removed. The black processing balls are removed extraorally and replaced with green high retention balls. In a 4-unit case, all green balls can be used for the definitive prosthesis. When greater than 4 implants are used for a LOCATOR F-Tx restoration, there is a limitation on the number of green balls that can be used per quadrant. The definitive prosthesis is seated intraorally, engaging the most distal implants first as previously described. The patient is instructed to bite on cotton balls with reasonable force to help ensure the retention balls are fully seated. X-rays are taken to confirm proper seating of the prosthesis. The patient is very satisfied with the final outcome, a more efficient procedure with a highly aesthetic and functionally strong final prosthesis.